Hi, welcome back to Nursing Manthra. I am Shinsi George. Today our video is related to US NCLEX RN Licensure application process for Texas Board of Nursing. Texas is the most populous state in the south central region of the USA. Texas is a compact state. That means the license we can transfer to other state, that is compact states. It means license from Texas we can change to other nursing boards which is under the compact states. To become registered nurse in Texas, USA, you must get license from Texas Board of Nursing. All the details has given in the Texas Board of Nursing website, that is bon.texas.gov. You can go through that. They have clearly mentioned for international qualified nurses what all the things we have to proceed. So if you have any queries, you can email to them webmaster@bon.texas.gov. We will see what are the documents required here. International passport, passport size photo with white background, degree or diploma certificate, mark sheets, course completion certificate, transcript is must. Okay, you have to get the transcript from your nursing college. 10th grade certificate, that is high school or secondary school certificate we have to get. 12th grade or higher secondary education certificate if your country is having that. Then marriage certificate, birth certificate. If your name change means we can submit the marriage certificate. Some case if marriage certificate not sufficient for name change, then name change affidavit we have to submit. Now we will see what are the steps for Texas Board of Nursing. Application steps are step 1, we have to complete the CGFNS, Credential Evaluation Service. That means complete verification from your nursing college for your education and from the licensing councils. Experience verification, CGFNS, now they are not doing, but we have to give the information, we have to fill the details where you had the experience. The supervisor details, the email ID, all these things we have to provide. The first page of the form has to fill by you, that means your signature and the date must be there, and other pages the principal from the college has to fill it. They have to take the new printout for the transcript, not our old transcript. The principal has to take a new transcript printout from the college and along with the course syllabus. Sometimes without course syllabus we can submit the educational verification, but it is always better you can inform your college to provide the syllabus, course syllabus, okay, plus transcript, plus this filled form and your degree certificate and mark sheets. All these certificates together they can courier directly to the CGFNS. Maximum 2 education, 2 license you can do at the same time. If you need to add additional documents, then the amount will be higher. Then license verification from the council, wherever you had the license, active license past 5 years, that license details you can add here for the CGFNS verification for the license. So you can approach your nursing councils and based on their protocol you have to fill the foreign verification application, and from the nursing council they will share the form, they will send courier to CGFNS. CGFNS application fee for Texas Board of Nursing, that is $450 USD. So CGFNS will transfer the advisory report. So it will take almost 1 month or 1.5 months whenever we are completing our application. So from the college the document has sent, then after that maybe it will take 20 days like that, 20 to 30 days. So we can expect 1.5 months for completing the CGFNS verification if all the details, everything we have done at faster. So after getting the advisory report, that is our education is compatible or our license is compatible, that is indicating the advisory report, then they will transfer the CGFNS report to Texas Board of Nursing, and the CGFNS will email us that they already shared the CGFNS details to the board. Next step, step 2, that is fingerprinting through Identico. Identigo is the company that is helping for fingerprinting process. So we have to do Identigo application fee, that is around 38.25 USD. So you have to do fingerprinting in FD258 card. FD258 card you can get it from Amazon, or you can request with the Identigo, they will provide it. So go to the nearest fingerprinting authority. Some countries it will be the police headquarters. Some countries there will be separate fingerprinting authority is there. So after finishing the fingerprint, all the instructions has given the Identigo. You will get the form to fill. So what all the things must be there in the fingerprint. All the details has given that. You have to make sure that you are filling the fingerprint card proper. So you have to send the courier all the fingerprint card, and along with the Identigo form, so you have to send the courier to Identigo services address. Third step is application submission through Texas Board of Nursing. In the Texas Board of Nursing portal, there is nurse portal is there. You have to do the application. You have to fill all the details. Then we can make the payment of 75 USD. Then step 4, NJE exam. That means you have to pass nurse jurisprudence exam. The passing score is 75%. That means 50 questions you have to pass 38 questions. Then you will get the pass score. Time limit will be 120 minutes. The questions are very tough, that you have to understand the ethics, rules, laws, responsibilities, all the details of the nurse, those who want to work in under Texas Board of Nursing. And there are so many files are there in the Texas Board of Nursing, circulars are there. You can read before exam. So don't worry, Nursing Manthra can assist you for the exam preparation. So within 20 days, the Texas Board of Nursing will check our application and all the files reached. That means our fingerprinting has reached and CGFNS has reached, all the files are reached, means the board will approve for NCLEX exam. Or if anything is lacking, they will notify through mail. Now step 5, Pearson VUE registration. So from the Texas Board of Nursing, we will get a mail that you are allowed for NCLEX exam. So we have to do the Pearson VUE registration. That is NCSBN registration we have to do. We have to register in NCSBN. It costs around 200 USD. So NCSBN registration, we cannot cancel it once we have done. We will not get any refund for that. Okay, so once you are ready for the exam, then only do the NCSBN registration. So step 7 means after NCSBN registration, you will get ATT. That means the authorization to test. Then if you are getting authorization to test, then only you can schedule the NCLEX examination. So within 90 days, you will get the ATT for scheduling the exam. ATT validity for Texas Board of Nursing, that is for 3 months only. So within 3 months, we have to write the exam. So that's why I told that if you are not prepared for the exam, then don't register in NCSBN. Once you are clearly, you are ready for the exam, then only you can do NCSBN registration, because soon after receiving your ATT, only you will get 3 month duration. Within that 3 months, you have to book the exam. Okay. Exam scheduling fee, that is around 177.50 USD. Exam rescheduling means if you are unable to write the exam, means at least 24 hours before, 1 business day before, you have to do the reschedule exam. Better to do 3 working days before. Step 8, after passing the exam, you have to apply for the nurse licensure. Okay, in the Texas Board of Nursing, you can apply for the nurse licensure and you can activate the license. Then after getting the license, you can just find out an employer and get the visa processing and all done, and the visa screening and all you can do through the CGFNS. Like that, you can proceed with the further steps. Suppose if you fail in the exam, you have to repeat the Texas Board of Registration. There is, you have to apply for the retest. NCLEX retest application we have to do. Again, we have to pay the NCLEX registration fee, 75 USD we have to pay. Then NCSBN exam like registration we have to do. Plus we have to do NCLEX scheduling fee also, exam scheduling fee also we have to do. Along with this, they will ask verification of registration from your licensing council. That means from your nursing council, there is one Texas verification form is there for the license verification. That form has to fill from the nursing council and they have to send it to the Texas Board of Nursing. Even they can email from the nursing council to Texas Board of Nursing. We can do it. If we want to transfer the AFRA NCLEX score to Texas Board of Nursing, Texas Board of Nursing will not accept the AFRA scores. AFRA means Australian NCLEX scores. Texas Board, they will not approve it. But the NCLEX score from Texas, that we can transfer to AFRA Australia, we can transfer it. If you have any doubt related to Texas Board of Nursing application, retest for the examination, fingerprinting or any processing or license transfer process, any process, you can contact Nursing Manthra.